Welcome back. Today we're pulling back the curtain on ClearChoice dental implants, the stuff you don't hear in glossy ads. If you've ever wondered why people swear by them or quietly regret them, stay with us. Dr. Esma is here and she's not sugarcoating anything.
Thanks, Rasim. ClearChoice can be life-changing, but only for the right patient at the right time. What most people don't realize is that the process, the pricing logic, and even who qualifies are very different from what the commercials imply.
Exactly. And here's the hook. Some patients walk in expecting a miracle in one day and walk out shocked by what they weren't told up front.
In this video, we'll uncover what ClearChoice does well, where the blind spots are, and the key questions you must ask before committing. If implants are on your mind, this could save you years of regret.
So let's talk about the moment most people recognize themselves. You see the ad, perfect smiles, same-day teeth, and you think, why not me? Dr. Esma, patients come in excited, and then reality hits, right?
All the time, Rasim. Many expect a simple, fast fix, but they're surprised by scans, bone evaluations, and long-term commitments. Some even discover they're not ideal candidates without extra procedures.
And that's where the confusion starts. You're already emotionally invested, you've imagined your new smile, and suddenly there are delays, conditions, and fine print.
Exactly. None of this means implants are bad. It means the story is incomplete. Understanding these scenarios upfront is what separates confident patients from disappointed ones.
Here's why this really matters. Dental implants aren't just a purchase, they're a long-term relationship with your mouth. Dr. Esma, when expectations and reality don't match, that's when stress kicks in.
Absolutely, Rasim. I've seen patients thrilled on day one, then frustrated months later because healing took longer or maintenance wasn't explained clearly. Others do great simply because they knew what to expect.
So the difference isn't luck, it's information. The more you understand before starting, the fewer surprises you face after.
Exactly. When patients know the full picture, implants can be incredibly rewarding. When they don't, even a good result can feel disappointing. That's why these details change everything.
Let's add some context here. ClearChoice didn't appear overnight. It grew fast because people wanted a centralized, streamlined implant experience. Dr. Esma, that scale changes things, doesn't it?
It does, Rasim. High-volume centers rely on systems. One internal review showed that patients who attended full pre-consultation briefings reported far higher satisfaction than those who skipped them.
That reminds me of a mini case. Two patients, same clinic, same treatment type. One asked questions, took notes, paced the process. The other rushed in chasing speed.
And the outcomes felt completely different to them. The treatment didn't change much. Their understanding did. That background knowledge is often the silent factor no one advertises.
Now let's shift gears. Dr. Esma, from a science standpoint, what actually determines whether implants succeed or struggle?
Great question, Rasim. Biologically, implants rely on osseointegration, the bone physically bonding to the implant surface. That process depends on bone density, healing capacity, and how precisely the implant is placed.
So it's not just about the brand or the building. It's about biology meeting engineering.
Exactly. When science is respected, outcomes are excellent. When timelines are rushed or individual factors are overlooked, problems appear later. That's why understanding the biology behind implants is just as important as trusting the provider.
Alright, let's make this practical. Dr. Esma, if someone is considering ClearChoice, what's the smartest way to move forward, step by step?
First, Rasim, start with a full diagnostic scan and ask for a clear explanation of your bone health. Second, request a written treatment roadmap with realistic timelines. Third, understand aftercare and follow-up expectations.
That already sounds calmer than rushing and chasing speed. Oh, yeah, the is the to the eye and needed. Need see.
Exactly. When patients follow these steps, anxiety drops and confidence rises. It turns implants from a gamble into a planned medical journey, which is how they were meant to be approached.
Now for the part people usually skip, the cautions. Dr. Esma, what should viewers absolutely do, and what should they avoid at all costs?
Do ask correct questions, Rasim. Do slow the process if something feels unclear. Don't ignore medical history and don't let urgency override proper planning.
So if it feels rushed or confusing, that's already a signal.
Exactly. The biggest mistake is assuming faster is better. Implants reward patience. When you respect that, results tend to be smoother, more predictable, and far less stressful.